Perimenopause, a journey you found out you've recently started. You know in a few years you would be embracing the big menopause. And you've quite possibly started mentally preparing for it. And then lo and behold, you find out you're pregnant. You probably assumed it wouldn't happen. SubhanAllah, sisters, can you imagine? But pregnancy in perimenopause is more common than you might think. So let us understand what we can do to prepare ourselves better for this stage so that we can make more informed decisions. Assalamu alaikum, sisters, and welcome to my channel. If you are new here, my name is Dr. Nikita Islam. I'm a gynecologist turned perimenopause health coach. I'm also a revered Muslimah and a mother to 3 wonderful children, alhamdulillah. I help Muslim women navigate through perimenopause and menopause with more focus, energy and confidence by following holistic wellness practices that are safe and effective, easy to follow and aligned to our deen. If you are interested in knowing more about perimenopause and menopause, I invite you to attend my free workshop, Hormone Wise, where I talk extensively about menopause and perimenopause and all the different changes that your body goes through during this period of your life. So what is perimenopause? Perimenopause is the phase leading up to menopause when your hormones, especially estrogen and progesterone, start to fluctuate. Perimenopause is not menopause. And if you want to know the difference between the two, watch this video. During this phase, your ovaries are still functioning, although irregularly. You may not ovulate every month, but ovulation still occurs unpredictably. According to the American College of Obstetricians and Gynaecologists, the ACOG, pregnancy is still possible until you have officially reached menopause, which is defined as 12 consecutive months without a period. I lived in Saudi Arabia for 10 beautiful years, alhamdulillah. And in that time, I worked in many different hospitals, met lots of lovely doctors and patients, and I have really fond memories of those days. So I had a friend and colleague from Egypt with whom I shared a very close personal and working relationship. She had 4 beautiful girls, mashallah. As she entered her mid-40s, she noticed that she had put on a little bit of weight, her periods had become very irregular, and she just assumed she was transitioning into menopause. Then she missed a few periods, and then the periods completely stopped. She thought to herself, well, this is a little bit earlier than I expected, but it's fine. We had access to an ultrasound in our clinics, and one of her friends did an ultrasound because she was having some kind of a tummy discomfort. And what did they find? A real kicking baby. She was so shocked and surprised that she couldn't bring herself to tell her daughters that they were going to have another sibling. She even kept the news hidden from her colleagues for some time. So yes, sisters, you can be caught by surprise. Here's a statistic that might surprise you. A study published in the journal Fertility and Sterility found that natural conception rate for women aged 40 to 44 is about 10 to 20% per cycle, while for those aged 45 and above, the rate drops to 1 to 5% per cycle. So while the chances are lower, they're not zero. Now let me ask you, do you know anyone who had a surprise pregnancy in their 40s? Maybe an aunt, a friend, or even someone in your community. Let me know in the comments. In today's world, many women delay having children due to career, health, or personal reasons. So if you're in your 40s and still hoping to conceive, is it possible? Yes, but with some challenges. Fertility does decline with age because the number and quality of eggs decrease. However, assisted reproductive technology like IVF has made pregnancy possible for many women in their 40s. According to the Center for Disease Control and Prevention, the CDC, success rate of IVF for women in their early 40s is about 20 to 25% per cycle. but it decreases to around 5% for women aged 45 and older using their own eggs. We are not allowed to use donor eggs, so that's a topic that I will not go near. So, if you are not planning a pregnancy, it is crucial to continue taking precautions until menopause is confirmed. Many women presume they can't conceive and stop taking precautions too early. If you're still getting periods, even irregularly, you can get pregnant. On the other hand, for those trying to conceive, supporting your body with proper nutrition, stress management, and medical guidance can optimize your chances. And remember the power of dua. Anything can happen by the will of Allah. We know that Ibrahim alayhi salam had a second son, Ishaq alayhi salam, at a very late age. Ishaq was born to his first wife, Sarah, and 3 angels came to Ibrahim alayhi salam and gave him the good tidings of a child, and his wife Sarah was astonished to hear that in such an old age she would conceive a child. But she did. What Allah wills, He will make it happen. Remember Prophet Zakaria alayhi salam, who was old and feeble, and his wife was barren. And he made dua to Allah subhanahu wa ta'ala, and he was blessed with a child. In Surah Anbiya, Ayah 89, he made the dua, Rabbi la tadharni qardan wa anta khairu raziqin. My Lord, do not leave me alone with no child, while you are the best of inheritors. Again, in Surah Ali Imran, in ayah number 38, he says, Rabbi habli min ladunka dhurriyatan tayyiba innaka sami'ud du'a. So my Lord, grant me from yourself a good offspring. Indeed, you are the hero of supplication. So don't lose hope. Ask your Rabb with yaqeen, and if it is good for you, inshallah, He will bless you with children. So, let me ask you, sisters, were you surprised by the facts that I quoted? Do you have personal experiences or questions about fertility in perimenopause? If you want to know more about the different symptoms of perimenopause, I have something for you. But before that, share your thoughts in the comments, and don't forget to like, share, and subscribe for more discussions on women's health during perimenopause and menopause from a mainstream medicine, holistic, and Islamic perspective. If you are experiencing different symptoms of perimenopause, I have created a playlist of the most common symptoms of perimenopause and actionable tips to help with them. Do check them out. Jazakumullahu khairan for watching, and I will see you in my next video. And remember, your best is yet to come.